Hello everyone, I am Dr. Ritika Goyal and I am a pediatric pulmonologist, allergy and sleep medicine specialist at Division of Pediatric Pulmonology, Allergy and Sleep Medicine in Center of Child Health, BLK-MAX Super Speciality Hospital, New Delhi. Today we're going to talk about a very common topic of discussion, and that is cough in children, especially the type of cough which just doesn't go. We often get patients in our clinic who complain of cough that is not going away completely since maybe a month or maybe more. It is a typical wet kind of a cough where the child has increased symptoms when he goes off to sleep or when he lies down on bed. And the parents say that they have tried everything. They're nebulizing, they're giving cough syrups, they're giving certain medicines. They've even tried alternate medicine like Ayurveda and homeopathy, but the cough is just relentless. It's not going away. So, what do we do in such circumstances? And what exactly are we dealing with? So, the most common cause of this kind of a cough that we encounter in practice is a post viral cough. Sometimes viral infections can affect these children in a way that even after the fever goes away, cough may not go away for 3 to 4 weeks. And this cough can be a dry cough or a wet sounding cough, but it can be really troublesome, especially if your child had influenza to start with. It is not uncommon for children of all age groups to have cough that is prolonged for 3 to 4 weeks after a viral infection. Especially after the COVID pandemic, what we've seen is that the children were so protected and not exposed to the external environment for the past 2 years that when they finally came out and started going to school, the viral infections affected them even more. So once they caught a viral infection and they had all these symptoms, it took them a month to recover from them. And after a month, they acquire another viral infection and the whole cycle starts again. Another common reason for this kind of cough is what we call an upper airway cough syndrome or a postnasal drip. Now, these terms sound complicated, but it's something very common and very simple. What happens is in children who have persistent colds, like they have nose blocks or sinusitis or some runny nose, itchy nose, these are all allergic symptoms of the nose. In such children, when they have a lot of mucus produced behind the nose, it drips down from behind into the throat and causes throat irritation. This is what we call as a post-nasal drip. Now, this throat irritation leads to a kind of cough that lasts for weeks or even months, and if not treated. Usually, this cough starts when the child lies down on bed at night or when he wakes up early in the morning. That's when all the pool secretions in the throat cause the child to have bouts of cough in the morning. In a city like Delhi, we are seeing a lot of children with childhood asthma. So what happens in asthma is that our airways, it's an allergic reaction that happens inside the chest in our airways. So what happens is they become extremely hypersensitive or they react excessively to a simple stimulus. The most common trigger for this hyperreactivity is a viral infection in children, but it can be any allergen. It can be an insect, it can be a pollen, a grass, dust mites, any fungus. It can be anything that the child is inhaling. What happens is when the airways become hyperreactive, they get triggered and the child has bouts of cough, even nighttime symptoms when he wakes up catching for breath. So if your child has a dry or even a wet cough that is going on for a long time, along with shortness of breath, or if you find that your child starts coughing when he runs a lot or does some exertion, some exercise, that is an indicator that you need to meet a pulmonologist as your child may be suffering from childhood asthma. Another common cause is a protracted bacterial bronchitis. Now, this is a very scientific term, but what exactly happens is that there is a small infection going on in the lungs which goes undetected in the routine tests. And we keep treating the child with cough syrups and cough suppressants and nebulizers with no long-term results. In that case, your doctor might give you a short course of antibiotics for around 2 weeks, and the infection will go and your child will feel better. Some of the other uncommon causes that we see in our practice as a respiratory medicine specialist are bronchiectasis due to any reason. It could be a genetic problem that leads to chronic cough. It can be sinusitis, a chronic sinusitis kind of a situation. It can be cystic fibrosis. These are all a little uncommon causes of this kind of cough, but they do exist. So if you feel that your child has this kind of a cough, which is wet sounding or maybe dry but lasting for months, not getting better with any of the routine medications that you're giving, you must think and meet a pediatric pulmonologist. Thank you.